Now, let's begin the conversation. Public trust in governance is often shaped by how clearly facts are communicated, especially in sectors as sensitive as healthcare. In Ekiti State, that clarity has become necessary following claims circulating online that the government allocated just 68 million naira to the primary healthcare. The state government debunked the claim, describing it as misleading and not reflective of the state's total allocation to primary healthcare or the health sector as a whole. According to the information officer at the Ministry of Health and Human Services, Wale Obelewaji, more than 2 billion naira was earmarked for primary healthcare in the 2026 budget. All right, gentlemen, Majid Jami, so good to have you join us on the show. So we're talking Ekiti State government here, but looking at this rumor, what specifically triggered, this rumor, and what does the budget actually say?
Well, I think we need to tell ourselves the truth. Social media influencers, like the character also known as VDM, I think they need to get themselves informed very well before making some frivolous claims. And even when you want to talk about the governor of a state, I mean, there's some level of decorum. It's not about a person occupying that seat, but then that position itself. Apart from the fact that he made very spurious and frivolous claims, incidentally, I'm from Ekiti State.
Oh, okay.
So I have an understanding of what governance is about in Ekiti State, what goes on there. In the 2026 budget, I think about 19.65 billion was allocated to the health sector as a whole. And you see, primary health care, when you hear primary, it has to do with local level. That's the first point of contact where women go to for child delivery, immunization and stuff like that. You see people going about now doing immunization.
Yeah, immunization, yeah, PID.
They are from the local government arm of the primary health care. And now the next question is, so if it is primary health care, what's it doing in a state budget? Yes, the primary health care system is a tripartite agreement. Local government, state government, and the federal government, and donor agencies. They fund the health sector. So the 65 million that was being talked about in that, I mean, I don't want to be talking about the person who made that broadcast, but I think I'm happy the state government made a clarification, and I think that clarification is very essential for Nigeria, because people will just hear some things from some of these so-called influencers, and without even fact-checking, they continue to go ahead and so basically, there is 2 billion naira for the primary health care system from the state government. Okay. Then the local, that's not inclusive of personnel cost, which is handled basically by local government. The local government pays the salaries of the nurses, the midwives, and the day-to-day management of the primary health care centers. So the state government's role is supervision and capital votes. Okay. In some instances, even this 19-point-something billion, the government might spend more than that. Like last year, I think they spent about 33-point-something billion on the health sector. So on healthcare, there are several other sectors in the health. So when you pick just one line item, and you now start comparing it with refreshments, you said they are spending so billion on refreshment, as if it's a Coke and water that they are spending the money on. When visitors visit a particular state, when the president visits a state, when the state governor hosts meetings these are part of the line item. And it's not just government house alone. ministry, because I've worked in government before, I know the way some of these things run. We want to do a sensitization on immunization, on what have you, a particular thing. You want ethnic groups to meet. The state hosts such things. They are channeled under refreshment.
Under refreshment. Okay, Femi, how do you feel? I mean, should there be legal consequences for persons who just go ahead to just spread falsehood? Yeah. You know?
Without excusing the sensationalism that the guy brought to bear as regards this topic, I think what raised his curiosity must be the importance of the health sector to us as a people. Okay. If you go by the 1978 Alma Ata Declaration, health is a human right, and every Nigerian is entitled to be taken care of by government. It beholds on every government at whatever level, primary, state, and federal, to take health care very seriously. It's a human right. You know, Olukoyera Kuti had teeth and flesh to our healthcare system in 1988. It was ministered between 1985 and 1992, Babangida regime. And he actually brought primary health care to the fore. It started with 52 local governments. Later, he spread it across all the local governments in Nigeria. And those were the golden era of health care in Nigeria. You see, primary health care is very important because it's the line. My wife is a medical doctor. That is the nearest health care facility to the people in the grassroots. In whatever village you have them. So it's very important. And I find it very curious that last year, the state government spent about 33 billion naira on health care generally. But this year, the budget is about 19.6 billion naira.
That's a reduction.
That's right, it's a reduction. And you see, I remember there was one head of state conference that I had in Abuja, and each African head of state pledged to spend 15% of their
the country's budget
on health. And we are not doing that. What Nigerians can enjoy and what Nigerians want to enjoy is quality health care. And these things cannot happen by magic. We need to budget for it. So I'm not excusing the shenanigans of our influencers whose primary aim is to make money. People don't know that they are making money at our expense. They look at this sensationalism and it adds to their number. They make money on Facebook, on Instagram, and all platforms. Whether it's true or not, people can't check because people are innocent. They take advantage of the innocence of Nigerians. But it is important, too, that our government pays premium attention to healthcare. Very important.
All right, we also just been told that BKO is also with us via Zoom. BKO, how do you weigh in on this matter?
Well, if something is not true, it is not true. If it is not true, it is not true.
Okay.
We all want improvement in terms of funding for the health sector. We are challenged health-wise in our country. And we all know that too much attention is given the tertiary health centers in our country, whereas a lot of the things that people, the ailments that people go to tertiary health centers to address can actually be dealt with at primary health centers. So those primary health centers, it is important that we fund them properly and put them in position to be able to deal with the routine health issues that our people suffer from. That's why I'm happy that some states have primary health centers in all the political wards, which helps them to bring quality health care as close as possible to our people. This is what we want to see. I agree that we must fund the health sector a lot better. Do you know that some Nigerians travel to Cameroon to get health care? Some Nigerians who are resident in Adamawa State, where I am currently, they actually cross the border into Cameroon to get health care. Yes, this is a problem that we need to address. We need to do better in the area of providing quality health care for our people. But improvement is also being made in some areas. For example, in Yobe State, renal failure is something that government is addressing frontally. And in Yobe State, it is free. Dialysis is free. Dialysis is extremely expensive. But in Yobe State, it is free. I interviewed people who are on their sick beds, who had suffered renal failure, and they confessed, they owned up that they're actually being taken care of for free. So some things are happening in some states that we don't even talk about. Yobe also has the biggest mother and child health facility in our country, but many people don't know because our people place so much concern on Lagos and a few other states. That's all. So I've given this background, to also amplify the fact that we need to improve in healthcare delivery, but it is no license to lie against the state.
Exactly.
It is no license. It is impossible to allocate 68 million to the entire primary health centers. That will not even pay salary for 1 month. 68 million will not even pay the salaries of those workers, those health workers for 1 month. So this was merely a one line item that somebody saw, amplified it, and some influencers did not bother to do due diligence. They are not journalists, no matter how they try to pretend to be journalists. They are not journalists. They don't have the training. They don't know about filtration. So we can excuse them to some extent, but a single line and item in a budget is not what you amplify as the entire budget for primary health care. And I like the way the state has responded. The state said the 68 million being quoted refers to a single narrow capital budget line item under primary health care. When all sector votes are considered, 2 billion is allocated to PHCs in the 2026 budget. I could have asked for more funding or explain or ask why they didn't get as much as they got last year.
Last year, exactly.
But some states I can explain, I move around a lot. So if the state focus so much on infrastructure renewal in the health sector, because I saw some infrastructure renewal in the Ekiti health sector when I went there sometime last year. So definitely that one will shoot up the budget because infrastructure can be really expensive.
Okay.
You are building health centers, you are bringing in new equipment, MRI, scanning equipment and all that. By the time you have supplied all of that, you don't then come back the following year to bring back those budget heads. So it means that your focus will change from infrastructure renewal on a big scale and supply of equipment, equipment that you are supplied this year, you are not obligated to supply the following year.
Okay.
Yes. Some people say, okay, sometimes you buy a generator, you buy the same set of generators. That's pure fraud. And if a state chooses not to do that, definitely you will find that the following year their budget could be lower than what it was the year before, because you don't need to again buy those things that you had bought the previous year.
Okay. All right then. Because of our time, just 10 seconds.
Yes, just like Jide said, one MRI machine costs about 1 billion. So if you have made provision for it last year, you can't repeat same this year. I think they draw down on the 33 billion to 19.6.
Okay.
Taking into consideration that what they will be doing now is maintenance and probably consumables.
Absolutely.
And and little of capital investments.
All right, straight to our next conversation. When the scale of a crime threatens public confidence in justice, the weight of the response often signals